You know, it's wonderful to be able to get an insight into people's stories, as we did there with Catherine, and with a positive result. But you have been talking about the necessity for people to have treatment for months now since the virus hit.
Yeah, good morning, Naga. I think those are two great stories illustrating different aspects of cancer care. But, you know, one of the key things moving forward, and we're all trying to encourage people, is to really seek attention and seek medical advice if they have symptoms or concerns that they might have cancer. It's important that we reassure people that hospitals are a safe place now. We've made a lot of progress since the beginning of the pandemic, and we have systems in place that ensures people can come to hospital, get a diagnosis, and of course get, as you've heard, a very effective treatment.
What needs to be back in place in hospitals at this moment in time in order to further encourage people that the treatment is available?
Well, I think everything's in place. I think that it's about getting the message out there that we can investigate patients. We do have the tools to make the diagnosis, and we certainly have the treatments to deliver effective therapies. You know, for example, when the pandemic first began, we weren't quite sure how safe it would be to give a patient systemic anti-cancer treatments. And although there are risks, obviously, associated with therapies that can immunosuppress patients, it would appear that these risks are actually much less than we initially anticipated. With immunotherapy, one of the new treatments we use to treat cancer, for example, there doesn't seem to be any increased risk at all. We can now deliver surgery safely, and we can now deliver radiation therapy safely. So that's a key message, and it's quite a straightforward, simple message. The NHS is open for business. We want to see patients who have concerns, and we want to manage them. And as we move into the second wave, which we think will be probably much longer, a flatter curve, we have to make sure that we maintain all these other medical services, you know, for patients with cancer, for patients with cardiovascular disease, etc.
It's very difficult to predict anything, isn't it? But I think one thing that was always very clear when we spoke to various oncologists was the concern that people would be reluctant to visit their GP or reluctant to get into hospital, as you've spoken about. What do you think the impact of this is in terms of later diagnosis or diagnosis of cancer in later stages now?
Well, I'm seeing this personally, that some of the patients that are turning up to our clinics, they seem to have more advanced disease. And when you take the history, you know, often they may have had symptoms that just emerged around the time of the first lockdown. They decided to put things on the back burner. And then, you know, there were other priorities, and eventually they sought medical attention. And so we are seeing patients with more advanced disease. And we know for virtually all cancers, one of the key elements of success, or for success, is actually making an early diagnosis.
Dr. David Cunningham, Chair of the Association of Cancer Physicians. Always good to talk to you, and thanks very much.
Thank you very much. Thank you.
Message there, very clear. The NHS is open. If you are concerned, talk to your doctor. The NHS is ready